Right. So if you have read and understood, considering with clinical examination station, kindly begin.
Okay. Um, good morning. I'm Dr. Kolade. I'm one of the exam candidates. Oh, sorry. I will enter the room, wash my hands, then introduce myself to the patient. Good morning. I'm Dr. Kolade. I would like to examine your left knee and both limbs also. To involves me touching you, asking you to walk, and then also moving the knee. Hope it's okay by you. After confirming the patient's name and age.
Yes.
Hope it's okay by you, sir. Okay,
Yes.
so I will want
Take
to
the
expose the
consent as well.
patient.
Yes.
Yes, I've
Yes.
taken. Yes, I want to expose the patient. I'll ask him to only put on his shorts. So he's
Yes.
going to off any trouser. So I'll ask the patient to stand up. Then after standing, he's going to off his shoe. I will look around if he has any working aids that he came in with. If I can see any or not, then I'll ask him to stand up. I will check, look around his left, his front side, and then the back to check his knee. Then I'll ask him to walk and then come back. Then after walking, I'll check his gait if he has atagic gait or even if he couldn't even walk, maybe because of the pain. Then I will ask him to lie down. After lying down, I will ask him if he has pain on his knees. So I will check for differential. If there is no pain on the left knee, I will check for differential warmth, and then I will also check for tenderness and over the left knee. While checking for the tenderness, I will check all around the patellar tendon, and then the quadricep tendon as well. Then check up both the joint lines, both lateral and medial joint lines, and then also check over the tibial tubercle, and then down to his anterior border of his tibial bone. Then after that, I'll check for the swelling, comparing both knees. So I will do the patellar tap. If the swelling is if swelling there is swelling, there should be obstruction of the furrows on the sides of his patella. Then I also check the patellar tap test to check for swelling that he has. If there is no swelling, then I can squeeze his the tie down, and then check the push, a little push to the
Okay.
lateral
You
side
were
to
examining and patient,
budge test.
yes, acquired injury 2 days ago. So patient knee is tender and swollen, and patient cries of pain. What would you do
Oh,
next?
yes,
You have
if
to
I will
consider.
stop
Yes.
that if patient has pain, and then go to the next test if it's possible, and then also offer patient
What would be the next
analgesics.
test? Yes. Yes.
So okay, after that I will check for the measure the
Quadriceps
quadriceps
circumflex. Yes. Yes.
circumference from 10 cm from the tip of the patella. Then I will check for anterior drawers and posterior drawers test. I also check for the posterior sac sign to assess for the posterior cruciate ligament injury. Then after that, I will do the last mark test to assess also for the anterior cruciate ligament injury. Then after that, I will extend the knee and then do the valgus stress test and the varus stress test to check for the medial collateral and the lateral collateral ligaments injury respectively. I will first do it with the knee straight, and then flexing the knee about 20 to 30 degrees and access for both of these ligaments. Then after that, I will check for the meniscus injury. I will check for both the medial first and then the lateral meniscus to assess for if there's any injury. Usually, I will bend the knee and then external rotate when checking for the medial one, and then extend it. If patient is having pain while doing the extension, then I will know that I will have to stop it. That means there's possibility of injury. Then after that, I will also check the popliteal to check for that can feed the vessel and that there is no swelling in the popliteal fossa. Then I will assess the distal vascular bundle, check for sensation, and then also check for the dorsalis pedis and then the posterior tibia, that both of them are okay. Then the other thing I want to examine for the patient is to assess his knee, and then to assess his ankle and then also his hip joints, ma.
Okay. You still had 1
Then
minute left.
motion, I will access the motion,
Movements.
range of motion, movements. Yes, both
Yes.
active, passive, active first, and then passive for both
Okay.
both knees to compare both, ma.
What if patient was reluctant because patient was in pain? So how would you
Pain.
convince the patient? You already did the special test, but I would recommend you do the movements, active first, then passive. If patient allows, then go ahead with the special test. So
Okay, ma.
yes, if time would have, and you check for the popliteal pulse and the popliteal force of MRCS. So you have covered almost everything. And what would you have done to complete your examination?
I want to test the
Hip joint
to
and
examine
ankle joint.
the joints above and below, the hip and the
Yes.
ankle joints, ma.
And the complete neurovascular
And
examination of
complete
both lower
neurovascular
limbs.
examination.
Yes. In this scenario, would you be only examining the injured knee or both knees?
No, I went examine both knees, ma.
Yes.
Initially
First,
for
you
the normal, and then
yes, pain-free, and then the
the
injured one.
the
Can you
left.
please present your case now?
Okay, I've examined a 37-year-old man
Yes.
with who has an atagic gait on the left lower limb, with swelling of the limb, with tenderness around the joint line. So with no tenderness, he has the anterior drawers test and the posterior and the Latchman test were both positive. The range of motion on the left knee is 5 to 110 degree active motion, while I was able to get full range of motion for the passive range of motion. Then the menisci, the McMurray test was positive for the lateral assessment of the lateral meniscus.
But
Was
here
able to
it was discomfortable, but no obvious pain. So McMurray test, if you have it positive, then okay. So right. So what are your differential diagnoses?
Yes, my differential diagnosis will include a cruciate ligament injury, also knee menisci injury will also be another differential diagnosis, ma.
All right. So how would you confirm
Or
your diagnosis?
arthrosis. Yes, to confirm my diagnosis, I want to do a plain radiograph of the left knee, standing, AP and lateral, and then also anterior, posterior, and lateral view. Then also MRI of the left knee, so as to assess for this soft tissue injury, ma.
Yes, this patient, because of injury, could only mobilize its knee 5 to 110 degrees. What is the normal range of knee movement?
Yes, the normal range of motion for the knee is 0 to about 140 degrees, ma. 130, 140 degrees, ma.
What treatment options can you offer this patient?
Yes, ma. The treatment option includes to rest the limb, ice compression, then analgesics and elevation. Then the patient, depending on the findings from the MRI, then that will also need, if patient needs any surgical intervention or not, ma.
How long would you advise rehabilitation for this patient?
The rehabilitation, at least if there is no injury, any soft tissue injury, especially because of ligament, if there is ligamental injury, patients will at least need to be off sporting activities for at least 6 to 9 months, ma.
Yeah, 9 to 12 months. Yes, okay. Good. So feedback, please. Did you ask in the beginning when you took the consent, you asked for exposure, then did you ask the patient to walk for you?
Yes, ma. I asked him to only be on his shorts, to off his trouser.
No, but did you ask the patient to walk for you?
Yes, I asked the patient to walk, ma.
Okay, I think I missed.
Yes, I asked the patient
because
to walk.
At the end you were explaining, but then I thought I have missed that you were asking the patient to walk for you. Right, it was good. You covered almost everything for examination. But the one thing that I felt that was weak was your presentation of the summary. In the last, in 30 seconds, you have to tell all the positive findings considering the STEM. If which test would be positive if patient has just post ACL injury, then which test will be positive? Is there associated meniscus injury or not? So because it is causing discomfort, but there is no obvious pain. So what could be possibility? Is there only ACL or medial cruciate ligament as well? So how would you determine which test would be positive, which test to tell at the end, or which test to mention at the end with the positive results? This, I thought there was little deficiency in that. Anyone else want to give feedback? Oh, thank you.